Good morning. I'm Michele Maffezzoli. I'm a clinical research fellow at the Portsmouth Hospital University NHS Trust and also a fellow at the University Hospital of Parma. Today I'm going to present our results on our global survey on confidence level in managing ADCs-related toxicities. So as many of you are aware, ADCs are a promising drug in medical oncology, and they are rapidly expanding across different cancer subtypes. And while they are very effective drugs, toxicity still remain a challenge. This is mainly due to the fact that these toxicities are really different from standard chemotherapy, and then they can vary across different ADCs depending on the payload and on the target. Managing toxicities, ADC-related, are a challenge for healthcare professionals all over the world. And through this global survey, we aim to assess the confidence level in managing ADC toxicities among oncology professionals. To do that, we use the ONCOassist app, which is a CE-approved application widely used from oncologists and nurses and healthcare professionals from all over the world. And through this app, we were able to reach more than 1,200 healthcare professionals from over 180 countries. So participants were asked to respond to this single item survey, and the question was, how confident do you feel managing toxicities associated with ADC therapies? And participants self-reported a confidence level between a scale of 1 to 5. And then we looked for predictors of confidence like income level of the country, role, subspecialty, and cancer type. So in these tables, you can see the baseline characteristics of our respondents. So more than 80% of respondents were physician. Looking at the subspecialties, medical oncology were the largest subgroup, followed by radiation oncologist and hematologist. Most of them used to manage gastrointestinal and breast cancer, but also lung cancer oncologists were fairly well represented. And again, looking at the geography distribution of the respondents, we can see then most of the participants were based in high and upper middle income countries, specifically in Europe and Asia, but also North America and South America were quite well represented. This is the table reporting the confidence level divided by physician and nurses and by continent and country income level. In the bottom line of each table, you can see that the higher confidence level 4 and 5 were reported in Europe and America, and as well as in upper middle and high income country. While we can see that lower confidence level were reported like in Asia, Africa, and in low and lower middle country, despite the low middle country were quite underrepresented in this survey. We think this is mainly due to the limited access to the ADCs and also a possible limited access to informatic resources. And the same can be said for the nurses. So higher confidence level were again reported in Europe and America and in upper and high middle country, despite again the sample size of the nurses limited the interpretation of the results. Here we looked at the confidence level divided by role and physician subspecialty. So on the left of the screen, you can see that senior oncologist and as well as nurse reported an higher confidence level compared to junior oncologist and nurse practitioner, respectively. So this is a sign that, of course, experience might play a significant role in managing ADC toxicities, and we might need to fill this gap. Looking at the subspecialty, you can see that medical oncologists and clinical radiation oncologists reported the higher confidence level. The interesting fact is that hematologists, despite accounting for a small subgroup, reported the highest confidence level like 44%. This is fairly expected, actually, because hematologists have been managing ADCs for a long time when compared to medical oncologists. And on the right, you can see that surgical oncologists had reported the lowest confidence level in managing ADC toxicities. And again, this makes sense as surgeons are less exposed to systemic treatment toxicities, which are mostly managed by medical oncologists and clinical oncologists. This is our univariate and multivariate table. If you can see on the right, we can see an interesting result. So for example, South America reported a higher confidence level in managing ADC toxicity, which is quite interesting, as ADC are quite a novel drug in this continent. So this might be due to like an optimistic approach, of course, towards new drugs, but also an overconfidence towards these drugs. They might feel maybe that the toxicity are quite similar to the standard chemotherapy. Again, we can see a significantly different distribution in confidence level when comparing junior and senior physician and nurse practitioner. And the other interesting results at the bottom line of the table is that we didn't find any particularly significant results when looking across different cancer subtype. And actually looking at the survey, we found that, for example, gastrointestinal cancer and lung cancer oncologists reported confidence level fairly similar to those reported from breast cancer oncologists, despite the ADC are mostly used and have been used for a longest time by breast cancer oncologists. This might be due to the fact that ADC are rapidly expanding towards different cancer subtypes, and there are actually available a lot of clinical trials involving the use of ADC either in GI as well as genitourinary and lung cancer. So in breast cancer are mostly used in clinical practice, while ADC are mostly used for now in GI and lung cancer and genitourinary cancer across clinical trials. So these are the conclusions. So we found in this global survey significant disparities in managing ADC-related toxicities, and especially the confidence level reported by the respondents to this survey might be influenced by the geography, the income level, the experience of the physicians, but also from the role and subspecialty. And we believe this is an important message, as a distrust again towards the ADC might lead to an underutilization of these drugs, which is actually unfair for the patient, because they can be really effective on cancer as a cancer treatment. And on the other hand, of course, an overconfidence in managing ADC toxicities might lead to an inadequate management of toxicity, which can eventually lead to a loss of effectiveness of the drug, and even a worse, a decreasing in the quality of life of the patient. So what we might need for the future, we might need educational intervention and mentorship programs to try to fill the gap of experience, to try to fill the gap between senior physician and junior physician. We might need multidisciplinary support system to fill the gap between subspecialties, so that we can improve the global standard of care of the patient all over the world. We might need to develop some standardized guidelines to manage ADCs-related toxicities in the way that this can be applied in every country in the world to fill the gap between different continents and different income level. Of course, there are some limitations regarding this survey. The main one is that this is just a single item survey, which can, of course, limit the depth of the analysis. But on the other hand, this was the only way to reach such a broad spectrum of participants all over the world. Another limitation is regarding the self-reported confidence level. So this is not linked to objective parameters like the ADC usage rates divided by specialty or by role or by country. So we do not have this data, and maybe a future survey or future trial might need these objective parameters to link to the confidence level. Of course, there are some small subgroup which are underrepresented in this survey, like the low-income country or the hematologist, and we didn't take into account differences in healthcare system reimbursements and research, which might impact on the confidence level. I would like to give a special thank to the ONCOassist team for their support and for enabling this global survey. Here you can find the citation of the full manuscript published on the Oncologist and the QR code related. Thank you so much.